Well, we start in the United States, where coronavirus infection and fatality rates are rising fast. And now the country's foremost infectious diseases expert has given his prediction of just how bad things will get. Dr. Anthony Fauci says there could be between 100 and 200,000 deaths in the US and millions of cases. His warning comes as the federal government considers rolling back some containment measures. Meanwhile, in Europe, Spain recorded another 838 deaths on Saturday. That's a new high. Its infection rate, however, was lower. And in the UK, there's been 209 deaths in the past 24 hours, raising the total there to 2,118. A short time ago, the housing minister says the UK hasn't experienced such emergency measures since World War II. Well, we have several correspondents covering all these latest developments. Francesca Minocci is standing by in Rome as we're waiting for new figures out of Italy. Sonia Gallego will bring us all the updates from the UK. She's in London. But first, let's go to Alan Fisher in Washington, D.C. Alan, some really grim numbers there, a grim prediction from Anthony Fauci.
Well, we knew that there would be somewhere in the region of 1 million or more cases. That's something the experts have been saying for a while. For Dr. Fauci to talk in terms of 100 to 200,000 deaths, that's really quite a stark reality on a Sunday morning. He says it's a moving target, and you can see that from the figures he's given. These are not precise figures. He's working from models that they're being presented with. On one hand, there's 100,000. On the other, there's 200,000. And when you're talking about people's lives, that is a very big gap indeed. He said that every town, every city, every state has to make preparations for the worst case scenario, because he says you simply can't gamble on it being the best case scenario.
Whenever the modelers come in, they give a worst case scenario and a best case scenario. Generally, the reality is somewhere in the middle. I've never seen a model of the diseases that I've dealt with which the worst case scenario actually came out. They always overshoot. So when you use numbers like 1 million, 1.5 million, 2 million, that almost certainly is off the chart. Now, it's not impossible, but very, very unlikely. So it's difficult to present. I mean, looking at what we're seeing now, you know, I would say between 100 and 200,000 cases, but I don't want to be held to that because it's deaths. I mean, we're going to have millions of cases, but I just don't think that we really need to make a projection when it's such a moving target that you can so easily be wrong and mislead people. What we do know, Jake, is that we got a serious problem in New York, we have a serious problem in New Orleans, and we're going to be developing serious problems in other areas.
And Alan, as we've been saying, there's been some fairly public criticism, including from government officials, of just how the White House has been handling this, especially now conflicting statements on a potential quarantine. Where do we stand now on all that?
Well, when you hear Andrew Cuomo talking about the numbers in New York, 56% of the cases in the United States are based in New York State itself. And Andrew Cuomo says the reality is the apex of the virus there won't hit for another 2 to 3 weeks. Now, in 2 weeks' time, we'll bang right up against Easter. And that's the time when Donald Trump had said just last week, just a few days ago, that he was hoping that the country would start to reopen and the churches would be full. Certainly what we're hearing from the experts is that that is unlikely. Anthony Fauci highlighted a case there when he says, look, we're growing numbers in New Orleans. That's because there was Mardi Gras there in the run-up to Easter. 1.5 million people in New Orleans. It's normally a big celebration. But of course, they went ahead with that, the Louisiana governor and the mayor of New Orleans, because at that point, the federal government, Donald Trump and others, were saying, we have this under control. There's 15 cases and soon it'll be down to 0. So they felt there was no reason for them to cancel this huge economic driver for the South. The reality is many more people would probably be infected because of that. And if they live in the South, then there's a real problem there because the health services in the South of the United States aren't as well developed as places as Los Angeles, New York, Seattle, and therefore that's a problem. And also there are more underlying conditions. Now, Anthony Fauci and others are saying, look, we can perhaps think about maybe possibly opening up the country in bits, but we have to understand there has to be extensive testing in those areas. And at the moment, the US isn't quite geared up for that. So the idea that in 2 weeks' time, the US is going to be saying open for business again, just goes against what all the experts are telling us, and certainly goes against what Andrew Cuomo, the governor of New York, and others are saying, in that it's 2 to 3 weeks before this virus peaks in New York, and then there could be other peaks in other parts of the country. This is going to go on for some time, and the White House is beginning to realize that.
Indeed. Alan Fisher there. We've actually also just been hearing from New York Governor Andrew Cuomo. We were showing you some of those live pictures. We'll be bringing you all the latest on that as we get those lines in. Thanks again, Alan. Well, let's cross now to Sonia Gallego. She's joining us live via Skype from London. Sonia, we've literally just heard in the last hour from the British government with their daily update. Talk us through what they had to say today.
Well, fundamentally, Anastasia, it's really to give an outline of exactly how serious the government's coordination and response is in relation to this crisis here. Now, it is they are establishing strategic coordination centres led by gold commanders. And as you mentioned earlier, the housing minister said there hadn't been this level of response coordination seen in the country since World War II, just to give you an idea of how much effort is going into this to try and not have too much strain on the National Health Service, even though it is already seeing some of the strain already. Now, they will be coordinating with the military as well, and with some of the first response units, ambulances as well. There's also a plan in place to get personal protection equipment to health workers, especially those in the front line, as quickly as possible. Now, this has been a very stern cause for concern for many in the health service who've been crying out that they don't have enough personal protection equipment with which to be able to do their jobs as well. Now, it's not just those working across the National Health Service, the 58,000 National Health Service healthcare facilities that there are in the country, but you're talking about pharmacies as well, dentists, care homes for the elderly, as well as also for social care workers. Those personal protection equipment is going to be rolled out to them over the coming week. Now, when you look at how the NHS has been dealing with this as well, there is also concern about testing as well and equipment not getting quickly enough to them. The government did pledge on Saturday that it was cutting the red tape to be able to have access to things such as hand sanitizers. It's also said that there is a lack worldwide of certain objects like this, but also it needs to have things like, for example, components for testing for health workers in the UK as well is of an enormous concern as well. And the urgency to get those as quickly as possible done and is paramount importance, really, because, of course, those who are feeling any of the symptoms have to stay away for 2 weeks, thereby putting more strain on the health system. Now, in relation to the deaths, of course, there still seems to be an idea that they are pretty much online with the death forecasts that's seen in Italy as well. The UK may not be seeing the same number of deaths as they are in Italy and Spain and in France, but it seems to be on track to be preparing itself to see some of those numbers here as well. And that, again, is a cause for concern. And that's why the underlying message, every time there is a spokesperson out there, a science officer, a medical officer, the message is the same. Stay indoors. Practice social distancing. That's the only way that they can get the curve pushed as far away as possible to avoid any strain on the health service.
Indeed. Sonia Gallego there, live for us in London. Thank you, Sonia.